But the irony is that they want the Aetna in there because they have so much wealth because of a booming economy that they want to expend more so that they can buy specialty services. In this country, we're at a point where we need to make sure that we have a huge problem with pediatricians. But the bill, as you know, incentivizes people and pays for docs to go into it. We think that doctors are value-added, allows for the medical expenses of them and to be paid off, and encourages them to go into this field. That doesn't work if you're already there and established, but I think everyone would agree that's a smart thing. And then to have a general practitioner, so that someone who can actually go out and have a general practice like we all grew up in. So there's a lot of work that we have to do, doctors. It's a good suggestion. I would point out to, listen, the reason I do public forums is because A, you should be accessible to the public. B, certainly not everybody is going to agree with you, nor do I expect that. But more often than not, I get the best ideas from the people I represent. And secondly, even at those that disagree with me, I respect you. And you help sharpen my focus. And that's good. Also, that's what a democracy is all about.
A lot of that dialogue. Part of that is around Paul Ryan's plan being a point of debate. Secondly, that you recognize the amount of cost we actually pay out now for health care. And we can't just allow that to grow and hobble our country for years and years to come and take us out of a premier position in the world. I also commend you for being in favor of pay as you go. That, how else can we seriously talk to our kids around what's right for us and how do we morally move forward without paying as we go. But the one concern I have, and by the way, just in general, as a political observer, I'm going to use a medical term, I suspect the Ryan plan is going to be DOA. So, dead on arrival, and that we really have to be thinking, okay, if you look around...
Well, it passed the House of Representatives already, so it's not...
I know, but you understand that there's a lot more cycles to it.
No, I understand, but
you have to have the president's involved.
But dead on arrival means never gets a shot.
If you look around here, the vast majority of us are not far left, right. We're in the middle. We want you to come and join us there. And sort of recognize these principles around how we move forward. Now, we understand there needing to be a guarantee, or at least a framework of safety nets. But the phrase I cringe when I hear you say it, especially around healthcare, is that you do not want to have a limit. There should not be a limit on various things, from certainly access, but even for cost and on the Medicaid side, nursing homes. There has to be limits. We have had a lot of years of building up our cost of health care, of new procedures coming in, far more expensive procedures, far more expensive drug programs. I mean, there are lots of drug programs that are tens of thousands of dollars per year that can go on for 20 or 30 years. We simply can't afford that anymore. We have to have a thought process, and that debate you spoke about around how do we start to set a limit. Up to now, we've been able to play the game of there is no limit. Now we have to say some way of forming a limit. And one of the areas that I encourage you to try to endorse and to help pull the public forward in is a bipartisan approach and a framework for that. And I mean, while it's a little more on the debt side, the Bowles-Simpson is a bipartisan commission that the president put in place that has key leaders from both sides that contributed. Can't we move forward and endorse that? And a core part of that being elimination of huge loopholes that are capable of funding the things that we really care about, and we really care about our health care.
Well, number one, I commend you for your very thoughtful question. I will say that I think that 3/4 of the Bowles-Simpson plan should be embraced, and it's something that should be embraced on a nonpartisan basis, because we're in that kind of a fix. But I would say for a framework, again,
last people first.
For bipartisan with respect to Medicare, is the modernization of healthcare records, the cracking down on healthcare fraud, the simplifying of records, and the coordination of care. And in the coordination of care, you encapsulated a number of these concerns. That's where I think, and to your point also, and I said this at the beginning, you have to be able to both look at cuts, but you also have to look at revenues in order to balance this thing. And
you talk about revenue.
you can't be blind to that, but
absolutely, and I'm not even saying to shrink back from the 17%. I think that's adequate. But we as a population are growing. We're all getting older. We're all going to be pulling out of
17%.
We're all going to be with a bigger population pulling out of Medicare and Social Security, and that system can't handle it anymore. So we have to recognize there are going to be limits on how much those programs can grow. And if we could at least say, all right, let's constrain it to 17%. Let's work hard at that fraud, at that making the whole system more efficient, so that we're getting more care out of the same percentage of. I'm not saying reducing. It's going to go up with inflation every year. But right now, it's accelerating away from us. We just heard the report that Medicaid.
I'll take your question outside because they have to get the ball.
I'm sorry, Medicare has shrunk by 5 years. In just 1 year of assessment, it pulled it in by 5 years. It's exploding away from us.
Thank you, sir. Thank you, everybody. Appreciate it.